born March 2nd, 1999.
And what would you like to be called?
Elizabeth is fine.
Elizabeth, fine. So like I said, we're gonna do a head-to-toe assessment. Are you having any pain?
No pain right now.
No pain. Any allergies?
No.
No allergies. Okay, great. So first what we're gonna do to get started is I'm going to inspect your head for size, shape, and symmetry. I'm also gonna palpate it for any lumps, deformities, inspect it for any hair patches or hair loss. Nope. And then I'm going to take a Q-tip for any redness, nevi. Everything looks good. Okay, great. When I was touching your head, was there any tenderness?
No.
Okay, great. Okay, now I'm going to check your frontal sinuses. Is there any tenderness here?
No.
Okay, great. I'm going to check your temporal arteries for pulsation. Okay, great, strong pulsations. If you could clench your teeth for me, I'm going to check your masseter muscles and temporal muscles. Okay, very strong. And now I am going to check your TMJ joint. Please open and close it, checking for clicking, smoothness. If you could please protrude your mouth and go side to side, okay, with range of motion with that. Now I'm going to look at your facial expressions. If you could please, I'm going to inspect your eyebrows, eyelids, and eyelashes. They look good, no scaliness, no patchiness, everything looks symmetrical. I am going to ask you to raise your eyebrows, smile, show both of your front and lower teeth, and then I'm going to ask you to puff out your cheeks. And now, if you close your eyes and try to open them. Okay, great. Okay, now I am going to do a light sensation. I'm going to touch a cotton ball on various places of your face and just let me know if you can feel them, okay? So please close your eyes.
Yep.
Great. Sensory nerves are intact. Now I'm going to move to your ears. And I'm going to inspect it for any scaliness, skin condition, any drainage, and everything looks intact and healthy. Now I'm going to use an otoscope to look inside to look at the temporary membrane. I'm going to pull the pinna up and look in, and I view the cone of light. Awesome. And now I'm going to put this away. Okay, and now I'm going to palpate your ear. Let me know if you feel any tenderness, okay?
Okay. No
In
tenderness.
the pinna, teres, and the mastoid process, anything?
No.
Okay, good. I'm going to now look at your eyes and just test your ocular movements. So you're gonna just keep your head, don't move your head, just move your eyes and follow the tip of my pen, okay? Okay, eye movements were smooth and the 6 cardinal gazes. I am now going to have you look up, and I'm going to pull your sclera looks good, and conjunctiva is pink. All right. Now I'm going to look at with oblique lighting your cornea and lens. If you could just look straight for me. Okay, great. All right. No scars. No cloudiness. Everything looks clear. Now I'm going to, still with your eyes, going to test convergence. So keep your eye on the tip of my pen and just follow it. Okay, great. Cranial nerves 3, 4, and 6 are intact. And now if you could just look off past a distance and then look to the, yep, exactly. So that's great accommodation. And then I am going to, I'm gonna shine, just look past me and I'm gonna shine the light and I'm just gonna look how your pupils constrict. Okay, great. All right, both pupils constricted. Pupils still curl up. Okay, so I did your eyes. So now I'm gonna, due to COVID restrictions, I would do a nose assessment. So I would look at her nasal mucosa, her septum, for any turbinates or perforations. I would also have her open her mouth and look at their teeth, gums, floor of her mouth, check her lips for moist and color. I would also ask her to say ah, and I would see that her soft palate rises symmetrically and the vulva stays midline. And then I would also ask her to stick her tongue out and go side to side for a range of motion and assess that cranial nerve. Okay, so now I'm going to move down to the neck. Yes. So I'm going to check, inspect your neck for skin color and symmetry. It looks as it should be. I'm going to palpate your trachea. It is in midline. Does that hurt or any tenderness? No. And now I will palpate your lymph nodes. So you have your preauricular, postauricular, superficial clavicular, deep clavicular, posterior clavicular, submandibular, tonsillar, occipital, and supraclavicular. Any tenderness with that?
No.
Awesome. Okay, so now I am going to inspect your shoulders for symmetry and skin condition. And I'm going to palpate. Does that hurt? No? Okay, so now we're going to do some range of motion with your neck. If you could chin to your chest, go ahead and go up. And then look to one side, look to the other side, ear to your shoulder, ear to other shoulder. Okay, great. Great smooth range of motion. Okay, now I am going to do your posterior thorax. I'm going to look at for shape and symmetry. I'm going to palpate for crepitus and tenderness. Does this hurt any? Okay, great.
No.
I'm going to palpate the spinous process and look for any tenderness and spasms. Any tenderness and no spasms. Okay, great. Now I'm going to listen to your lungs. So just take a deep breath and out with an open mouth, okay? Just go ahead and do that when you feel my my stethoscope on your skin.
Okay.
Thank you. Okay, great. So no advantageous sounds, and lung sounds were clear with auscultations on both lobes. Okay, so now I'm going to do your respiratory pattern anteriorly for if any labored breathing or use of any use of accessory muscles, and there's not, so that's good. So now I'm going to listen to your lung sound anteriorly. So again, just take a deep breath and breathe out through your mouth, whatever my stethoscope touches. Okay, great. Okay, so now what I'm going to do is do a light sensation. I'm going to assess your ability to feel sharp and dull sensations, okay? So this is going to be sharp and this is going to be dull, okay? Go ahead and close your eyes and let me know.
Sharp. Dull. Sharp. Dull.
Okay, great. And I would do that bilaterally. Okay, so now what I'm going to do is inspect your elbows for skin condition and symmetry. I'm going to palpate it for any nodules, swelling, heat, anything like that. Any tenderness? Okay. I'm going to take your brachial pulse. Okay, great. And I would do that bilaterally, so +2. We're going to do range of motion for your elbows. So go ahead and flex, extend, supinate, pronate. Great. And now we're going to test your strength for your elbows. So go ahead and do this again. And then I'm going to try to pull you, and you're going to resist that, okay? Okay, and then now I'm going to try to push it forward, and you're going to resist that. Okay, great. And I would do that bilaterally, and strength is 5 out of 5. Okay, now I'm going down to your wrist and your hands. I'm going to inspect the dorsal and the palmar side for skin condition, and it looks good. No swelling noted. I'm going to just palpate the joints for bogginess and tenderness. Anything?
No.
Okay, great. So now we're going to do some range of motion with your wrists. So if we're going to do like this, and then this, to the inward, outward, spread your fingers apart and make a fist. Okay, great. And now we're going to test the strength for your hands. So go ahead and squeeze as tight as you can. Great. Strength 5 out of 5 bilaterally. Okay. So now we did that, your upper extremities. So I'm going to lay you down. Oh, yes, lay down. Go ahead. And get your feet up. Are you okay?
Yeah.
Is this comfortable? Okay, so I'm going to take your carotid artery pulsated. Okay, great. It's really strong. Okay, and I would do that to the other side. And I'm going to take her apical pulse. Okay, apical pulse is present and palpable. Okay, so now what I'm going to do is listen to your heart. And I'm gonna aortic, pulmonic, Erb's point, really strong beats, good. Tricuspid and mitral. And if you could please turn to your left side. Okay. Okay, great. And then now I'm gonna still do that with the bell side over here. So again, moving it, doing it with the bell. Okay, S1 and S2 were heard, no murmurs present. So now what I'm going to do is observe, inspect your abdomen for any pulsations. No hernias present. Color is even throughout. So I'm going to now auscultate your right lower quadrant. Okay, vowel sounds are active. And now I'm going to palpate, so just let me know if you're feeling tenderness.
No.
Okay, great. Okay, so now I'm going to move down to your knees. I'm going to inspect it for skin color. Some symmetry in skin color. I'm going to palpate it. Does this hurt?
No.
Okay. And then I'm going to take your popliteal pulse. Okay, popliteal is present, and I'm going to do that bilaterally. Now we're going to do range of motion for your hips. So we're going to flex, extend, abduct, adduct, internal rotation, external rotation. Great. And then I'm just going to palpate for your any tenderness, and hips are symmetrical. Okay, great. So now what I'm going to do is pain sensation. So again, so this is sharp, and this is dull. Okay, so just let me know.
Sharp. Ow. Dull. Sharp. Dull.
Okay, great. And I would do that bilaterally. Okay, so next I'm going to do is just check for any edema. It doesn't look like there's any edema. Hold for 5 seconds and no edema present. Okay, great. So now what I'm going to do is take your posterior tibial pulse. Okay, great. And your dorsal pulse. Okay. And then I'm going to check the range of motion. So go up, down, inward, outward, and now we're going to check strength. So try to, against my resistance, try to move your foot up. Okay, have your foot up, and then try to push it down. Okay, great. And then what I'm going to do next is sit you up, and I'm going to do your reflexes. Okay, we're going to start with your brachial. Okay, your triceps. Okay, and then your brachioradialis. Oh, that's a good one. Okay, and then we're gonna do your plantar, your Achilles. Okay, great. All right. And then one more thing we have to do is take your no, I did that. Okay. Oh, your radial pulse?
Wait, yeah, you did.
I didn't do it. And your brachial, I didn't do brachial. Your brachial pulse.
Radial.
Radial pulse.
Oh, sorry.
Okay, great. +2 and now we do that bilaterally. All right. Do you have any questions for me?
No.
Okay. Thank you. All right. I will let the doctor know the findings. Everything's with the normal limit, so he did a really good job. Okay. Thank you.